Hello, my name is Zan Mulligan. I'm a junior here at Michigan State. I'm in the College of Natural Science studying neuroscience, and this is my submission for the Amplify STEM video initiative. Today I'm going to be talking about Antonia Novello, who was an American physician and public health administrator who served as the 14th Surgeon General of the United States in 1990. She was both the first woman and the first Hispanic Surgeon General in national history, and she served from 1990 to 1993 as a Surgeon General. She was born in Fajardo, Puerto Rico in 1944. She earned her medical degree from Puerto Rico as well, the University of Puerto Rico. She graduated medical school in 1970. Following that, she immediately began a pediatric internship at the University of Michigan and became the first ever woman to earn the University of Michigan Pediatric Internship of the Year award. She continued to get her master's in public health from Johns Hopkins in 1982, and then a PhD in public health also from Johns Hopkins. That was after her tenure as Surgeon General in 2000. Throughout her professional career, she amassed dozens of national recognitions and medals that include the Exemplary Service Medal and Humanitarian Service Medal, which are two of the most prestigious honors that a public health professional can achieve. During her time as the U.S. Surgeon General, she focused intently on pressing issues of the time, the 1990s, that included both childhood immunizations and the HIV/AIDS crisis. While she was in office, she made several meaningful efforts to mitigate the effects of the HIV and AIDS crisis. In the early 90s, the AIDS epidemic was significantly worsening as it approached its peak in the mid-90s, by 1995. And Novello particularly focused on awareness and education, using her position to promote campaigns to inform the public about things like transmission, prevention, and the impact that the virus would have. These education efforts included the importance of safe sex, testing, and education about blood transmission through needles, particularly for intravenous drug users. She supported a number of policies that led to the development of antiretroviral medications and helped make healthcare services more accessible for underserved communities. These efforts extended past just the domestic, as she led collaborations with other nations to share and exchange information pertinent to the epidemic at the time. Her work during the AIDS crisis was some of the most important of the time, leading to a massive increase in awareness and significant progress of relief efforts. Novello's work throughout her career certainly played a role in developing the infrastructure of public health discourse in the 21st century. She fostered awareness not just for HIV and AIDS, but for healthcare disparities as a whole. Her legacy includes all of this humanitarian work, and as the first woman and the first Hispanic Surgeon General in the nation's history, she broke barriers that were posed to both Hispanic people and to women in professional settings. She has served as an inspiration to not only Hispanics and women, but for all people who are looking to promote diversity in professional STEM settings. Antonia Novello did incredible work for underserved communities and continues to inspire decades after her tenure as the Surgeon General.